Hello, my name is Dr. Adams and I'm a dentist at Maryland Holistic Dentist in Burtonsville, Maryland. And today we're going to talk about root canals. I've been receiving a lot of phone calls and visits to my office about people who are concerned about root canals. There was a documentary that came out on Netflix within the last few weeks, and the movie's called Root Cause, and they were addressing some of the health concerns with root canals. So this is something that we've been dealing with for a really long time, how to properly remove a root canal. And a lot of people, when they search for us online, they are looking for a dentist who will take out the root canals and clean everything out properly and ensure there's no infection. And they always ask the question, well, how do you properly take out a root canal? So this is the way you properly take out a root canal, simply put. The first thing we do is you want to carefully remove the tooth. And carefully removing the tooth is definitely exactly what you want to do, because when you take a tooth out, you don't want to force it out, pull it out, break bone, traumatize gum tissue, and make it a lot more difficult to heal in a situation where there are already a lot of problems. So what I typically will do is remove the crown that is on top of the root canal tooth. Most root canal teeth do have crowns, and you can simply take the crown off by making a little cut front to back, and that crown will just peel off like an orange peel. It's really that easy. Then you can get a better look at the shape of the tooth. A lot of the root canal teeth that are coming out are molar teeth or premolar teeth, and really, if you think about it logically, a tooth is like, in many ways, is like taking out a tree. You have a big tree in your front yard. The last thing you want to do is hook a chain up to it and rip the thing out of your yard. It's going to take out the bushes and take out all kinds of stuff. There's going to be a lot of collateral damage. So typically what I will do is I will carefully separate the tooth into a few pieces. And if it's a 3-rooted tooth, we'll take it out like taking out 3 splinters. And I'm not going to sugarcoat it. You know, we take a drill with a lot of water and we very carefully will separate it into a few pieces. And then you can take the roots out one at a time. So that's step number 1, to carefully get the roots of the teeth out. And you want to make sure you get the entire tooth out. A lot of times these root canal teeth, well, they're always dead teeth. And just like, you know, going back to that tree analogy, you know, dead wood gets a little more brittle every year. So roots of teeth, you know, especially old root canal teeth, these roots are really brittle. And they will crumble into a lot of different pieces. And if you get real lucky, it'll come out, like I said, in 2 or 3 simple root pieces. If you get unlucky, a lot of times, you know, you may be there picking and plucking and then getting out pieces for several minutes. But however the tooth comes out, you do want to make sure you get the entire tooth out. And once you get the tooth out, oftentimes there's a lot of scar tissue and granulation tissue that has been surrounding the roots of the teeth. The body's really smart. It'll grow cysts. It'll wrap around the roots of the teeth. And when all the bacteria and fungus and toxins leak out of the root of the tooth, your body has this tissue that's growing around the root to prevent the, you know, all this yucky stuff from spreading everywhere else. And this tissue has its own blood supply, and it is very important that you remove the, you know, the granulation tissue and scar tissue or whatever you want to call it. The other thing you want to do is you want to remove the PDL. A lot of times I get the question of, do you need to remove the PDL? You know, isn't it sufficient just to remove the tooth and the body will just take care of the rest? It is absolutely necessary to remove the PDL and the cyst tissue. Number 1, if you do not remove the PDL and the cyst tissue, the bone cells are blocked from migrating into the extraction site, and what will happen is you'll have like gum tissue and bone will grow over the top, and there's a high likelihood that you'll maintain a space, kind of like a bubble-like area down in the bone where the bacteria and, you know, whatever pathogens are in there survive, and they will literally feed off your blood supply and dump their toxins and proliferate and do their thing. And, you know, you'll just be dealing with this for an indefinite period of time. So at this point in time, we got the tooth out carefully. We've got the site all clean. No more PDL. No more cyst tissue. And we're just going to send the patient home and everything's going to heal perfectly, right? Wrong. Because here's what's happened. A lot of the bacteria and the toxins have leaked down into the pores of the bone. Bone is a very, very bad place to have infection because your defense is essentially in your blood. That's where your white blood cells, red blood cells, everything else that can help you fight infection. And there's not a lot of blood supply in bone, and that is the problem. So when you get infection and other contaminants and toxins that have gotten down in the bone, it can take a really long time and for that to heal, and infections can spread and really last a long time and cause a lot of problems. So once we get that site nice and clean, I will take a mixture of ozone and oxygen gas, and we will force, under pressure, this gas, like air. Gas is really nice. A lot of times people don't think about gas, and it's a really good means for delivering medications. But gas can travel into many places that liquids and solids cannot get to. And a lot of times getting medications to the site of the problem is really the big challenge. And I'll get this question of people like, well, can't I just take antibiotics and it'll fix this problem? And I'm like, well, no, number one, all the bacteria and toxins are in the root of your tooth. It's dead, so there's no infection in there. That's the problem with root canals, is you can have infection that is in a part of your body where it can just proliferate unchecked, and then all the yuck leaks out of the bottom of the root and into your system in very high concentration relative to the concentrations that you might get otherwise if you just had a simple infection. Your body is very smart. So if various pathogens get into your body, typically it's in a place where there is blood supply, and it's not too far away from a white blood cell that'll realize that it's there, and guess what? Your immune system is going to rip that thing into little pieces. But if you have millions and trillions and gigabillions of bacteria and fungus and toxins sit inside of this root where your immune system can't even get to it, it doesn't take a dentist or rocket scientist to imagine how much stuff can pour out of that root. It's like one or two bacteria that are trying to find a place to hide compared to, like the force that you might find coming out of a fire hose just blowing out all over the place. And that's the kind of, concentrations. I know that's kind of a stupid one. I know it's not, but I don't even know if that's the right scale, but, long story short, you can get a lot of stuff leaking out of the roots of these teeth and into the bone where you don't have much blood supply, and, it's a real problem. So if you get bacteria and fungus and toxins into the jawbone, infection can spread into other places. A lot of times it won't go too far, but, you can have, bacteria that are trapped in the pores of this bone, and the oxygen and ozone is a gas, so that gas will just quickly disperse and go through the pores of the bone, and the oxygen will promote healing, and the ozone will kill a lot of the anaerobic bacteria. And that's the way we properly treat these root canals. Once we've treated with the oxygen and ozone, I have this treatment called platelet-rich fibrin. I'd love to take the credit for making this up. This is something that dentists and orthopedists, especially us holistically minded people, have been doing for a while. And essentially what we do is we will draw a little bit of blood from the patient before we do the procedure. I'll typically numb the patient off, and then while they're in the process of getting numb, I'll simply draw a little bit of blood, much like if you were getting blood drawn at during a regular annual checkup with your doctor. And what we do is we'll spin the blood in a centrifuge, and for this particular preparation, we'll spin our centrifuge at 2,700 RPMs for 13 minutes. And magically, this substance we call platelet-rich fibrin will, come to the top of the test tube. And long story short, it looks like yellow jello, and it's a relatively concentrated mixture of white blood cells, fibrin, platelets, stem cells, and bone growth factors. And what I would do is I'll take this yellow jello looking quote unquote platelet rich fibrin mixture, and I would place it down into the extraction site where the tooth came out and fill it up nicely. And then of course there's going to be holes where the teeth used to be, you know, penetrations in the gum tissue, and this is very much an open wound site. So and then finally there's the gum tissue that used to be attached to the tooth will be kind of loose, and I will take stitches and just kind of wrap them around and kind of hold the gum tissues. The stitches are intended to hold the gum tissue stable and kind of hold the platelet rich fibrin treatment down into the extraction sites. And that is really, you know, exactly the way that we treat these root canal sites. And what I find is if you do these things, that these sites will heal really well. Sometimes I'll get people and they'll say, well, do I really have to do that? You know, it costs more to do the PRF treatment. You know, can I not do that? Well, of course, dentists have been extracting teeth for years and years and years. And, you know, there are some people who get lucky enough to heal without these treatments. But within the last 5 years or so, these PRF treatments have become very popular, and I put together okay, so there you have it. My name is Dr. Adams. Again, I'm a dentist at Maryland Holistic Dentist in Burtonsville, Maryland. And I hope you've enjoyed this video about how to properly remove root canals.